Hey, ladies, welcome to Wellness Wednesday. How is everyone? Hope everyone's doing great. And I don't know about you, but it's been a busy day. Hey, so that timer, just FYI for any of you English, let's see, legend nerds out there, that was a picture of Merlin's cave near Tintagel, so in Cornwall. Uh, I found that picture earlier and I thought, yeah, I'm going to use that one. So, anyway, we're going to get started. It's nice to be with you again. Just a few days, I know, back we were doing the master class, and I told you today we're going to continue with our Q&A because you asked a ton of questions, great questions, and I want to be sure to answer more of them. Let me say my disclaimer while everybody is jumping on. So for sure, anything, excuse me, that I say tonight is just health information and is not specific health advice. Do not start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to make changes first, please consult with your prescribing practitioner or doctor to so they can help you make the appropriate changes. And by attending this Wellness Wednesday, this does not establish a doctor-patient relationship. Okay, I'm being told I'm off to the races. Our sound is good. That's nice that it's working. Um, and hopefully you can see me okay. All right. So, um, like I said, so many great questions. And I want to pick up with a really important question, because I think it's where a lot of you are, sometimes with, what you think you're eating may be good. April says, I got over my 2 week plateau. Thank goodness. I have dropped 2 pounds in the last 6 days. I found a few synchronistic combinations that work. I have a question. I'm still eating a small amount of sugar, an almond butter breakfast biscuit cheat, she says, with my coffee, 1/3 to a whole bar daily. It is uh, the added sugars, 20% of the daily, daily oh, what D she says DV, and I can't remember what that stands for, or if she typed it wrong, but daily allowance, I'm thinking on the label. Will this keep my gut microbiome from achieving healthiness and keep impeding my progress? I am truly seeking the facts. This is on my mind daily. I'm still losing weight, but have not lost my full belly bloat in 25 years. She says, I'm 69. It's been it's been a stubborn problem for decades. Okay. This is where I think many of you are kind of stuck because you you still have to have that that sugar somewhere. It's like it seems like a necessity to you, like you need it. Um, there's a few things, and so you don't necessarily realize why you're not making progress, even though you're not having just a little bit of sugar. You're just having a little bit, okay? And that's where a lot of you stay stuck, because when it comes down to it, when you consume sugar and your body makes well, there's two problems with what she's doing. Okay, let me clarify. It's not only the sugar, but it's also the coffee. All right. So the sugar thing, if you have a blood sugar problem, if you have a weight problem, you have a blood sugar problem. This means that you need to get as much added sugar, if not all added sugar, I mean, really, all added sugars out of your diet. There is no shortcut, ladies. It will not work. And you will have very, very slow, if any, progress. The other thing that's kind of shooting her in the foot is the coffee. And caffeine raises cortisol, which raises blood sugar, which causes insulin to surge. That leads to fat storage. And if you have autoimmune disease, that leads to your immune system attacking whatever part of the body. If it's Hashimoto's, remember it's your thyroid. It's going to attack your thyroid. So, and the bloating, um, I don't know what else she's eating, but if she's having any sort of gluten or grains, corn, um, dairy, she could certainly keep bloating from that. But yeah, that's usually why you're stuck. It's still getting in there somehow. All right. Okay. Next question. We're going to go through these, like I said, as fast as I can to answer as many as I can, rapid fire. Christine asks, is GLP-1 safe to use if you have underactive thyroid? I have said a lot about these GLP-1s, like the semaglutide, these peptides, right? Uh, Ozempic, Wegovy, Mounjaro, these types of drugs. When you have underactive thyroid, you already have a metabolism problem. And when you're putting a drug in there that causes more insulin production from the pancreas, you're screaming to your body that you want to make that insulin resistance worse. Okay. When you already have a metabolic problem because of the low thyroid, your metabolism is not good. And you will get more insulin resistant when you make your pancreas produce more insulin. And that's what these drugs cause. So how can that be good, especially when you have low thyroid? It can't. It is not. And furthermore, it really isn't safe anytime, because any weight that it causes you to lose, of any weight you lose with it, 50% of that can be muscle. And you cannot afford to lose muscle, because that will ultimately make the blood sugar problem and insulin resistance worse. The long-term effects, let me see, there was a question on this. What do GLP drugs actually do in the long run? Asks Doreen. Ads, doctors, friends, and ads are pushing this as safe, and it helps with weight loss, high cholesterol, and heart conditions. In the long run, it will not help with those. It will make you more insulin resistant. It'll push you toward diabetes faster. They have not done the studies, the safety studies. This is why these are only meant to treat blood sugar issues, okay, as an option, and they're not sold as weight loss drugs in Europe. They will not sell them for weight loss. These drugs are dangerous. They have side effects. They act like neurotransmitters that make you more prone to depression and other mental illness. And there's just no place in medicine for these. There's no place for these. I know they can lead to some weight loss if that's the only. Now they're trying to come up with all these added effects, and they're cherry picking data. Ladies, please understand, the drug companies cherry pick the data. When they're spewing all these results, these potential benefits, you have to look at who's funding the studies. All right, please look at this. All right. Elaine asks, oh, sorry, Mary asks, I've been on tirzepatide for months now and haven't lost any weight. Well, there's a red flag. Get off it. Sorry, I can't offer advice. If anybody is taking these and not losing weight, which is the purpose that usually you're taking these for, the general answer is why is a question. Why are you taking it then? She says, I'm hypothyroid on 137 micrograms daily for 20 years. I have extreme body aches, hair loss, and many other things. What should I do? Again, ladies, you have these, many of you have these symptoms. These are typically blood sugar symptoms. Okay, the fatigue, the cholesterol, cholesterol, body aches, hair loss, can be blood sugar or infection issues. This screams screams for comprehensive testing, right? this is why we need comprehensive testing in order to see what is actually causing these problems. And for her, and you ladies who are still struggling with that, it's not helping you lose weight taking these drugs. You just have to ask yourself, why are you taking them then? Because if they don't help in the beginning, they're certainly not going to help now. All right. So simple question, maybe, but maybe not. It just uh, it's hard. Elaine asks, my thyroid swelled up on the right side. I'll spare you some of the details here. And then swelled up on the left side or the other side the next month. The X-ray had an X-ray, or I'm suspecting a ultrasound, and it showed a nodule. The second time it swelled up was after a pneumococcal shot. So when they healed, they tingled with small pins and needle feeling. I'll never know what went on. Any comments? I gained 60 pounds after that. I don't know that if that had anything to do with it or not. No problem since. Figured it was another medication she was taking. Okay. So the real problem with what's going on is she's probably missing information that she has Hashimoto's, and that is only determined with comprehensive testing. Because what causes nodules in the first place is typically Hashimoto's, the autoimmune condition that affects your thyroid. And autoimmunity, whatever it is, whatever the immune system is attacking, like in this case, the thyroid, it's going to have triggers. And whatever those triggers are, in her case, she got a vaccine. It's going to cause the immune system to attack more aggressively. All right. Whenever the immune system is triggered, and it can be triggered by blood sugar issues, insulin surges, infections, toxins, inflammation, low thyroid hormones. There's all these triggers. All right. And I talk extensively about this in the Fix Your Thyroid Masterclass that I'll be doing next. Not sure when yet. We'll announce that. So we don't know what she's dealing with, but these things can happen pretty rapidly when your thyroid gets inflamed, usually because of autoimmunity. All right, that's why. Very good. So the next question comes from Angel. She says, can you address hormones on thyroid? What happens after a hysterectomy? Or my thyroid change? I'm not sure what she means by that. My fatty liver and my cholesterol is getting worse, but I'm eating better. So there's a lot here. The thyroid affects everything. Okay. I'll get to that also with another question. And so this affects hormones, and especially after a complete hysterectomy, or after a hysterectomy, don't know if it's complete or not because she may still have had ovaries. This certainly will affect those tissues, whether it's the ovary tissues not getting enough thyroid, whether it's the liver not getting enough thyroid. Cholesterol is going to go higher because of low thyroid, regardless of eating better. And cholesterol also gets worse when there's a blood sugar problem or insulin resistance problem. And of course, saying I'm eating better doesn't really tell me what she's eating. So, but the main takeaway is thyroid hormones lower will certainly affect hormone activity in your body. And this is generally what causes symptoms with menopause. Ladies, you get symptoms during menopause because you have low thyroid and because of blood sugar problems. We're having more and more trouble with this. If you were to go and ask your great-grandmother, great-great-grandmother, if she had a bunch of symptoms when she stopped menstruating, she would probably tell you that no, that she just stopped menstruating and that was it. It's these added problems that we find we're having more and more because we live in a more toxic world now. We live in a stress-filled world now. I mean, I know they had stressors, but we have information coming at us all the time. I mean, I'm guilty of providing that information all the time. But we live in an information overload, and then we get stressed out, cortisol rises. This impacts our thyroid function. This impacts immune function. If we have autoimmune, it can even lead to autoimmunity. So that's how those are connected. All right. Kim says, and this is the question I was referring to, I'm 70 years old. I've not had my hormones checked in years. I'm not even sure at my age they should be, but kind of think they should be because of low libido and other stuff. I had a complete hysterectomy in 1990, was on ERT right after for 5 years. I'm assuming that means estrogen replacement therapy, and went off of them. The only thing I know I'm off on is adrenals. A few years ago, I saw a functional doctor and did a spit test, and that doctor said he'd never seen cortisols as low as mine ever. So she's 70. She has a hormone issue because she had a hysterectomy, right? No more hormones. Well, that's not true, because even even if you've had a hysterectomy, the body has a backup plan, because every woman, every one of you women need to have, must have hormones, or you wouldn't be alive. Um, and so if you, I was just checking my text. Um, you have your tissues require estrogen, and they require some testosterone, and they require some progesterone. There's always a baseline level. Whatever age you are, you should have a baseline level, okay, of hormones. Your adrenals help pick up the slack to help you produce these from DHEA, right, to make estrogen and testosterone. And then progesterone comes from cholesterol directly. And that happens in the liver, in the adrenals, in the skin. In fact, a lot of your estrogen is made in the skin if your skin's healthy enough. So sometimes it's not when you're aging, because you've been deficient, nutrient deficient for too long. And so her adrenals, yeah, they're off, because all the stress and the stress hormones that the adrenals made up to that point in her life, it's going to drop off, right? It's going to drop off because her adrenals are tired, and they're not getting, especially with low thyroid, if she has low thyroid, which I suspect she probably does, but we would have to do testing. And blood sugar issues will drop adrenal function to where, well, they can't even produce cortisol much anymore. They're going to be really, really low levels. And so that's the way this goes. It's not just because she's aging that she's feeling like this. So in the take home, she should have baseline hormones, just lower than when you're menstruating. She should have some cortisol ability, producing ability in the adrenals, but because of overstress and toxins and all these things that we deal with in our environment, she is decreased in her production. So that's the story on hormones. And the more we age with these problems, the more affected your hormone levels are going to be. All right. Last year, Kathy asks, last year I was diagnosed with mild asthma. I already have prediabetes. I'm 30 pounds overweight, brain fog, etc. Could this new diagnosis of asthma be part of the hormonal imbalance too? I suspect that there's multiple factors, mainly mold toxicity that she hasn't been able to release, because 98% of the time patients with these problems have the genes that I went over in the class, in the case study, showing that we can't release toxins from our bodies our bodies can't get rid of them. And so they stay there and they lead to sensitivities and allergies and asthma. Leaky gut causes asthma. And then, of course, when your liver's trying to detox you, and there's the liver's decreasing its ability to detox you from toxins, those toxins are going to move out in other ways. They're going to move out through your skin, kidneys, and lungs. And so this is a case likely where toxins are trying to get out through her lungs. All right. That's like the overflow valve. Okay, if that makes any sense. So this is a follow-up. It was on my text, having to do with that Ozempic question. All right. Doctors put my husband on Ozempic for blood sugars and heart. Is there a benefit for heart patients? I'm going to say no. And true studies have not been done. And therefore, again, doctors are only listening to the drug companies for these recommendations. And the drug companies are doing these studies. These are not done independently. And I would be very leery about having, these really taking these to treat these problems that we really don't have enough data on. It's a general guideline. Look, if there's not enough data over time to show how these actually, just because something shows an inkling of a benefit doesn't mean it's going to continue that way over time. Longer term studies are needed, and it's just common sense, right? It just comes down to, the sensible need to give it more time. Give it more time. And then who's funding those studies, right? Who's funding those studies? Okay. Danielle asks, let's see. Well, yeah, are protonics bad for your gut? And Danielle, that's a good question. Protonics are like omeprazole. They are acid PPIs, proton pump inhibitors. They block acid. And they are detrimental to your gut because you will not digest your protein very well. And that undigested protein will go into your gut and cause inflammation and lead to leaky gut. It will also lead long-term to magnesium deficiencies, problems with cognition. These are linked to problems with cognitive decline over time. These are not meant to be taken for long periods of time. They are only meant to be taken to help ulcers to heal, and that is it. It should only be about 4 weeks that these are ever given, and doctors leave patients on these for years. Okay, that's unacceptable. Lori asks, interested in the effects of poor producing thyroid that now has no medication to treat the problem for about 7 years. I am 65 years, 65. What are the consequences for the thyroid not receiving this medication so they have so many of? I think what she's saying is, she's wondering if the thyroid's not getting this medication, what are the consequences? Please understand it's not just the thyroid that needs thyroid replacement. In fact, that's not it at all. Your whole body needs thyroid replacement hormone if you are indeed low. If after getting the right tests, right? So the effects of your body not getting enough thyroid are your organs and tissues start to fail in their metabolism. Okay. And that starts to affect your blood sugar problem too. They feed each other. And then you get lower and lower metabolism, and you won't be able to lose weight, and you won't be able to grow your hair back, and you won't have more energy. It'll get worse and worse, right? Your stamina will suffer. Your heart can start to have problems with arrhythmias. This affects your memory, your focus, causing depression and anxiety, all the symptoms that I talk so much about. So those are the consequences of your body, not just the thyroid, not receiving this replacement hormone. And yes, they can be synthetic, they can be natural, they can be, combinations, natural desiccated, but um, that's those are the consequences. And if you, this question is, well, there's a question coming up I'm going to get to hopefully. Linda asks, what do you think of LDN for getting down antibodies? The goal of treatment is never really to get antibodies down. That doesn't really matter. The fact that they're in your blood at all, they're going to cause your immune system to attack when the immune system's triggered by anything. Having higher antibodies isn't necessarily any worse than having lower levels of antibodies. So the real gauge for getting this autoimmunity into remission is taking care of your triggers that are causing the immune system to attack. LDN is a Band-Aid. I used to prescribe it a lot. It is a Band-Aid to get inflammation down, but it doesn't actually reverse the causes of the inflammation. It is still functioning as a Band-Aid. So you're just stuck on another medication that may have some effect maybe on your pain. It can help with pain, chronic pain. But it's really going to be an individualized thing. And, once in a while I've used it, but I haven't used it in a long time. All right. Charlene asks, when I tell my doctors that my blood sugar goes up when I go for a walk, they tell me I must be wrong or my sensors are bad. But they hesitate to reduce my levothyroxine even though my TSH is low. Is there a safe way for me to cut my dose? I am convinced that it is causing my liver to push out extra glucose. How can I tell if I have reduced it too much? What are the risks? Okay, there's a lot of cause and effects here that are wrong. Levothyroxine is not causing your liver to push out extra glucose. What's happening is when you go for a walk, it's actually too strenuous for you. It's stressful. Cortisol rises, and that pushes sugar out of your liver. Do you follow? Too much stress, whether it's physical, chemical, emotional stress, will cause cortisol to rise and push sugar out of your liver and raise your blood sugar. That's what's going on. It's not about lowering the levothyroxine, even though the TSH is low. That's one of 12 thyroid markers. So they're not even getting a complete picture. You can't decide if you should have your thyroid medicine lowered just because there's a low TSH. What if there's a low TSH because your pituitary cannot make enough TSH? Think about that. What happens if you have mold toxicity affecting your pituitary gland so it can't make enough TSH? What if you have a problem where you're missing your pituitary gland? I have patients who have been missing their pituitary glands and they don't make TSH. So we have to give them thyroid replacement medication because the thyroid is not going to produce this on its own. It has to have TSH. So we have to give people like that thyroid replacement hormones so their whole body metabolism can work better. Okay? There's so much about this. It's very complex. And this is why it's very important to find a doctor that can help you, that can understand this, that isn't just going to look at a lab and a number and say, well, your number's high or low. This is what we need to do. No, that's lazy and incomplete healthcare. It's not healthcare. It's sick care, and it's lazy and incomplete still. And I'm sorry to be blunt, but that's what it is. Okay, moving on to the next question. And this is good because I think a lot of us have this kind of question. I buy organic produce at this certain store and recently learned that our drinking water has fluoride, plus the store adds a chemical to the water they mixed the produce with to kill bacteria in the lines and sprayers. Is it possible to wash our produce at home after that to make it safe? And what could we use for that? Thank you so much. Thought we were safe eating organic produce and now this. Yeah. Unfortunately, a lot of water that stores use to mist their vegetables, including organic, is full of a lot of things. So you can wash it. You can rinse it in some white vinegar and then rinse it, right? Rinse it really good. That could be helpful. Um, just there are some, I don't know, they seem gimmicky to me on Facebook for washing your vegetables. Some of those may have some merit, but I can't really give you like a definitive opinion on that because I haven't really studied that. Um, if it says it's organic, it probably is still better, but you still have to look at the labels and do the best you can. You can get there's certain apps that scan barcodes, like I want to say one of those is Fig, and there's some others that can tell you if there's other things with those with those vegetables, like the appeal. If some of you have heard of that, even some of the organic produce has been shown to have some of that. So it's kind of a bad deal, but you have to just do the best you can. If it says organic, you can probably trust that it's okay, but that's we're still taking some risks. I mean, grow your own vegetables, grow them organic. I don't know. I mean, it's for those of you who can do that, I think you have a leg up, but for those of us who also supplement our vegetables with organic produce from the stores, you just if it says organic, it's more likely to be really organic than if it doesn't say organic. So that's the way I look at it. Andrea says, if this is all true, why aren't physicians trained to deal with the real problem? And this is a great question, and I do address this. Oh boy, every masterclass seems I talk about this, and it's simply because doctors are not trained beyond finding disease. We are trained in medical school to find disease, and there are certain markers that have been established as standard markers for finding disease, and that's what we're taught. We're not taught to dig deeper. That's not what medical education is about. And as I have looked into it, medical education is funded by pharmaceuticals, right? Big pharma and insurance companies. And so we have to be really careful. Um, I think doctors going into school these days go in there with the right intentions, and doctors in general have good intentions to helping you. They just don't know what they don't know, and you can't really blame them. It's like I say all the time, you can't take your iPhone into you know, into an appliance repair place and expect them to be able to fix your iPhone. Much less can you expect your doctor, who isn't trained to do this, to actually find your root causes and help you treat them. They don't have the model of care that works to do this. They don't have the training to look at the other markers that are necessary to find the root causes. Um, it's like Kelly's question here. I understand it costs money to be healthy, but why is functional blood testing so expensive? And I have to argue, I mean, okay, it's more expensive because we're ordering way more tests. Like they just add up. But like in this last class, I gave you an opportunity, if you were watching that class, to order testing at basically a tenth of the cost what these tests are actually valued at, uh, retail. What they actually charge for these tests, if you don't go through insurance, go to a hospital lab, they will charge you 10 times what I was able to get these tests for you. That is not expensive. Simply not. It may be more than you have, and I understand that. But this is an amazing opportunity. Like, I don't know. I You can't get them for free, but we're talking about, you know, and insurance companies will only pay for certain tests. They will not pay for extra markers to dig deeper when standards have been set for certain markers to find disease. That's what doctors are going with, and that's all they can really go with. And I think the tide is turning. I think that more and more doctors are recognizing that they need to give you better answers. They just don't have them. Okay. And that's why I do what I do, because I know that there are answers. There are um, there are more markers to give us more information about your body. And when I can get them so much cheaper because I'm able to, you know, able to, um, get them to lower the cost because we're getting so many in a bundle, then I don't know. It's not expensive, but it's, it's absolutely necessary. Okay. Why aren't endocrinologists checking reverse T3 levels? And she says, when you're taking Cytomel, endocrinologists don't check reverse T3 levels anyway, because it doesn't help them. They don't know what to do with it. Um, if one does check it, I'd be shocked. And then you would ask, well, did they do anything different with it? No. Cytomel is T3, and they're not really going to necessarily get reverse T3 when someone's taking T3, because T3 does not convert to reverse T3. That doesn't happen. They're mirror images of each other. They don't convert back and forth. T4 converts either to T3 or it converts to reverse T3. And they have different enzymes that cause that different production, that different conversion. And it happens for a reason in your body and your liver. But endocrinologists really don't know what reverse T3 does or is, and it doesn't change their therapy anyway. They're going to still treat you with the thyroid replacement and go from there. All right. Mary asks, why are endocrinologists so fixated on just your TSH lab when only despite your current symptoms and what you are telling them what you're experiencing? I've been dealing with very dismissive doctors since 2012. It's really beyond one's comprehension. And she says, thank God I'm an ICU nurse and have been advocating for my health. It's extremely exhausting, though. It is, Maria, it is exhausting. If you're listening to this, I know, because they are only trained to look at that TSH and make adjustments based on that. So they're fixated just on that because they don't know any different, to be honest. And checking the other markers, T4, T3, all the rest of the thyroid markers, the reverse, the index, the free and total levels of T3 and T4, the antibodies, the thyroid antibodies, to see if you have Hashimoto's, like, it doesn't even matter to them, really. All that matters is that they have this hormone replacement for you or not. And they've done their job when they can get your TSH to be normal. And that's treating a number, not treating you. And they just don't know any different. So that's the best answer I have. Brandy asks, what are ways to keep mold out of your house or levels low when living in hot and humid environments? Certainly there are things you can do to clean your air, and there are many different things out there like the Air Doctor and others. And I'm not necessarily promoting that to you guys, but it is one of the better units that I have seen on the market for reducing mycotoxins in your environment, the spores in your environment. And that's generally what you have to do. But sometimes you need to go further, test your house using an environmental relative moldiness index test, and take steps to at least fog the house with a dry fogging if it's positive, okay? And then using something like the Air Doctor or something. I mean, there's several other ozone air cleaners. There are many others that I'm not necessarily going to promote, but they can be helpful. Many of those can be very helpful in keeping your air cleaner in your home or workplace. Is there a correlation, Kelly asks, between the MTHFR gene mutation and Hashimoto's? So this is a mutation that causes your body that causes low activation of certain B vitamins, so B12 and folic acid. These have to be methylated, and that's what MTHFR stands for. Methyl tetrahydrofolate is the methylated version of folic acid. And this is the active form. Okay, this is what works in your tissues to help with metabolism, help your thyroid work better. The methyl group is required by every cell for thyroid to work in your cell. So it's absolutely necessary, and it causes low thyroid. It doesn't necessarily lead to Hashimoto's, and having Hashimoto's doesn't necessarily affect the gene itself. So there really is not a direct correlation between those two entities, okay? All right, so there is, let me check my messages. Jamie asks, is there anything else you can take for a statin drugs? There is no reason to lower your cholesterol. I need you gals and everyone to understand this. Cholesterol is not the bad guy. The science, the actual science, shows that high cholesterol does not cause anything. Look into this. There's a study done in 2016, BMJ, British Medical Journal, showing that higher levels of LDL correlate with longevity. 2021 study in one of the geriatric journals, I forget which, shows again higher LDL correlates with longevity. You tell me, why are they now coming up with these? These independent studies have been showing this for years, that cholesterol is not the cause. It's based on bad science that went back to the 70s, 60s, 70s. They didn't report on all the data. That's not good science. And yet, pharmaceuticals revved up on this, started mass producing these statin drugs. They do not prevent anything. If anything, they're keeping cardiologists in business, because you're still going to have a heart attack or stroke if you're inflamed, regardless of whether you have high cholesterol or low cholesterol. And that gets you into the cath lab and into the stent lab where they can do their interventions. Okay. Sorry. There's plenty of research done to show that statins are harmful. They cause lower cholesterol levels, which harm your brain, harm your ability to deal with inflammation properly. They stress your liver, cause insulin resistance, blood sugar issues. They completely stop your CoQ10 production, so that which you need in every single cell, CoQ10 in every single cell to make energy. Okay. And if you can't make energy, what happens? Your cells will go they'll go dormant, and you will not produce enough energy, and you'll get more and more tired. You'll get sore. You'll get achy. You'll get weak. So there's no reason to take these drugs. Okay. And they actually do cause increased blood sugar, and they do not help your heart. This is not the reason. I mean, there really isn't a good reason to take the statins. Your heart is going to be at risk because of inflammation, first and foremost. And that's the reason why your liver produces more LDL, to deal with the inflammation. Right? So that's That's the truth behind the statins and behind cholesterol. If you take cholesterol away, you're taking the firefighters away from the fire. You're taking important nutrients away from your brain, and this will cause worsening. This is why we've seen a drastic increase in Alzheimer's and dementia. All right. Okay. I don't have a thyroid. I had a thyroidectomy. Do I still have a metabolism without a thyroid? Not much of one unless you're taking thyroid replacement, because your cells need thyroid hormone to turn on the metabolism. That's what that hormone does. So if you don't have a thyroid, you'll need thyroid replacement to keep your metabolism going. If you don't take anything, you're really struggling, and that's probably why you have the symptoms you have, and they're just going to continue to get worse. And it is, looking at the time, I want to answer one more question about stevia. I read an article. This is Sandy. I read an article, and hello, Sandy, if you're on, discussing new research linking stevia to digestive issues, diabetes, weight issues, and more. Many shakes and supplement powders now have loads of stevia and are so sweet they're almost difficult to consume. I would love to hear more from you on the subject. Perhaps replacing the stevia I use with organic maple syrup or date syrup might be better choices. No, date syrup is it'll raise your blood sugar way more. I wonder if monk fruit falls into the same category, an issue as stevia. No. Being it comes from a plant, I wonder if the article is really worthy of consideration. Again, would love to hear more from you, as I suspect you've been keeping up with the research on it. So what happens is, this may be something they're seeing in studies. Again, see who's funding these studies. If it's the sugar industry, I would be suspect, right? I haven't looked deeply into this particular research, but look at who might be funding the research, first of all. And secondly, it is true that if you have an insulin problem and you eat anything sweet, no matter what it's sweetened with, it can still raise your blood sugars because or raise your insulin levels, because that sweet sensation, that sweet taste, still alerted your pancreas to make insulin. And the more insulin you make, the more resistant to insulin you get. That leads you further on that continuum that I shared in the class toward hyperglycemia, insulin resistance, and diabetes. So there is potentially a correlation. And that's why I say all the time, if you have a blood sugar problem, a weight issue, cravings, try not to even have anything sweet. Get away from the need for something sweet. Start getting used to getting your nourishment from proteins, vegetables, and healthy fats, which are the essentials. There's no essential carbohydrates. Your body makes glucose from these other nutrients, from these other foods. So you don't need to get glucose in to survive and to thrive, really. In fact, the more glucose you bring into your system, the less you thrive, right? So date syrup, far too much sugar, fructose. Maple syrup's a little better, but again, just make sure you're not having something every day. Make it a treat. It should be once every 2 to 4 weeks, really. If you're having these issues, if you're having weight issues, don't touch anything sweet unless it's just a small treat with one of these alternative sweeteners every couple of weeks or so. That is all I recommend. Anybody who has a weight problem. I'm going to leave it there. We are way over time, but I enjoyed, man, time passes so quickly. I answered a lot of your questions, but I do hope to get to a lot more of them as I pop into the group daily, and I'll answer more questions, more of your questions. I don't know, I'll try to say the name so that you know your question's being answered. But you all ask really great questions, and it's clear that you want answers. And I know that we can provide you answers here, and so have hope, right? You have more answers, and remember, you still have the power to heal. Thanks for joining me, everyone, and have a great rest of your evening.